Hi again, everyone. So I'm Stephanie. I'm an associate professor in the School of Public Health at the University of Alberta. So I'm joining you from Edmonton, which is the traditional Treaty 6 territory, traditional lands of Métis and First Nations people. And I'm very humble and fortunate to have had the opportunity to work with many Indigenous communities in the province. How I came to study wildfires is as a health services and policy researcher. So unlike Ed, I haven't spent my career studying wildfires, but I am particularly interested in how traumatic, stressful events like natural disasters and public health crises impact the health and well-being of vulnerable populations, including Indigenous peoples and communities. So in response to the Fort McMurray wildfire, otherwise known as the Horse River wildfire in 2016, my research team and I created a research program called Indigenous Health and Resilience Through Disaster. So our logo here represents the fireweed. So for the wildfire scientists on joining us today, you'll know that the fireweed is a plant that springs up upon burned land. So that's really what the logo that we chose to symbolize, and it's a symbol of resilience. So the plants grow steadily, never in silos, and it's a symbol of regrowth. So there are multiple objectives to our research program. So we wanted to understand the factors that helped Indigenous elders, adults, and youth cope during and after the wildfire. Our team also examined how Indigenous residents and communities were affected by the evacuation and recovery process. And lastly, we wanted to identify the health and mental health impacts that the wildfire had for Indigenous peoples living both on reserve and settlements and in urban Fort McMurray. So the Horse River wildfire, it resulted in a mandatory evacuation of 88,000 residents and the loss of close to 2,400 homes and commercial buildings. It had an estimated cost of $8.9 billion. And it really resulted in extreme devastation, destruction, and displacement among residents in the area, which included loss of homes, jobs for many people, finances, lives, injuries, and impacts on mental health and separation from loved ones. So what about Indigenous peoples residing in the region of Wood Buffalo? So there's an estimated 80% of residents that were living in the three communities that were hardest hit by the 2016 wildfire in Fort McMurray. So those communities included Waterways, Beacon Hill, and Abasand. Métis people in the region, in the regional municipality of Wood Buffalo, are represented by 6 Métis locals, and there are 5 First Nation communities in the region as well, including Fort McMurray 468, Fort McKay First Nation, Chippewa Prairie Dene First Nation, and Mikisew Cree First Nation. So what was particularly I was particularly interested in was understanding how our provincial health system responded to the health and mental health impacts following the disaster. So we know that the impacts from wildfires, and many researchers have studied the impacts of wildfires and other natural disasters on Indigenous peoples, and we found similar results that resulted from the evacuation experience itself. So what did the evacuation experience look like? How messaging around the evacuation was communicated, and the setup of hotels, so how residents, families, and communities were evacuated. Recent studies have examined the effects of disasters on health and well-being of Indigenous communities. So there's been a lot of research that's looked particularly at mental health and stress following natural disasters. And we also know that Indigenous communities tend to live in disaster-prone areas, which makes them particularly vulnerable to natural disasters. The other important thing to keep in mind here is that there are jurisdictional and intergovernmental relations that do affect disaster and emergency response in Indigenous communities. So in Canada, the provinces and territories are responsible for managing emergencies within their own respective jurisdictions. So Section 91 of the Constitution Act of 1867 prescribes the legislative authority of the Government of Canada to First Nations to manage and set up their own management plans, including conducting assessments of hazards, risks, and vulnerabilities facing natural disasters. However, we know that this doesn't always happen in the best possible way after disasters. And so sometimes there are inequities with respects to resources and how resources and funding are allocated to communities to help them in their response following a disaster. So one of the things that we know about disasters, the Fort McMurray disaster in particular, was that coming out of Alberta Health data, which is our provincial health authority, is that the wildfire in Wood Buffalo there was an average number, the average number of emergency department visits had gone up following the disaster in Fort McMurray, and so it increased from an average of 5.9 visits per day compared to 1.7 visits per day for the same time period 1 year prior to the wildfire in 2015. So we know that healthcare utilization rates tend to be lower among Indigenous residents compared to non-Indigenous populations. So things like racism, discrimination, and lack of culturally appropriate healthcare have been demonstrated to be barriers to healthcare among Indigenous peoples. And our finding also showed from the fire that that healthcare utilization for Indigenous residents following the fire in Fort McMurray remained low because of distrust of the health system, but also because a number of services had shut down. So part of that distrust was not being able to access health services when they needed, and also during the evacuation, when they evacuated to their host communities or cities, they experienced a number of challenges and barriers to accessing needed healthcare services during that time. So one of the things that we were interested in is Indigenous experiences or Indigenous ways of coping. So contemporary definitions of coping in the research literature generally include personal, family, and community characteristics that contribute to individuals' abilities to heal in the face of adversity or stress. However, these definitions are derived largely from research involving non-Indigenous populations and may fail to incorporate unique characteristics from Indigenous perspectives. So recognizing that all Indigenous peoples are unique and in terms of their unique histories, cultures, and languages, Indigenous perspectives of coping are often grounded at a cultural level and are focused on community relationships, identity, connection to the land, and culture across generations. So one of the things that we heard from Indigenous residents and communities was that the wildfire heightened their stress and mental health experiences as resulting from the fires. So they talked about things like displacement, destruction of the land, and disruption of traditional land-based activities that resulted from the fire. The quote here that I've included from one elder involved in our research really expresses this notion of how that disconnect and displacement from the land had affected his ability to carry out traditional practices like hunting. So the elder states, quoted here, "Nature is all gone now. I used to see deer and rabbits on the road, but now after that fire, there is hardly any traps for hunting. You travel towards Saskatchewan and there are no traps. There's hardly anything, no wildlife." Structural inequities is also something that came up in our research findings, which demonstrated the ways in which Indigenous peoples were able to cope following the 2016 wildfire. So some of the things that participants in our research had highlighted were things like disorganization with the evacuation and recovery response. And that particularly included how the evacuation plan was communicated to residents. So not just Indigenous residents, but all evacuees. And they noted that there were inequities in resources. So while the wildfire happened in Fort McMurray, so in the urban center, neighboring rural and remote communities outside of Fort McMurray were also devastatingly affected. So many of those communities outside of Fort McMurray were host communities for residents who had fled Fort McMurray and had evacuated to those communities initially before those rural and remote communities outside of the city who then decided to evacuate themselves. But when they had sought resources and support for their evacuation process, they felt that the number of resources that were allocated to urban Fort McMurray in comparison to some of the rural and remote communities outside of the city varied. And so it's important that we think about what those inequities are in terms of the number of communities that are devastated by natural disaster. Now, while disasters can change community relations and community cohesion, which result from the separation of families and loved ones, the fire also brought everyone together. So there was emphasis in our research from participants who noted that they appreciated the opportunity to connect with others in their community, that they were able to rely on their community members who offered support. Many families welcomed others into their home during that time. And one of the things that we had facilitated a year after the fire happened were sharing circles that brought together elders, adults, and youth to talk about their wildfire experience and the ways in which they were able to cope during the evacuation and following the disaster. So throughout their recovery. And many of those participants in the sharing circles noted that it was really that was the first opportunity for them to talk about their experience, and they appreciated the opportunity to connect with others who had gone through similar shared experiences, shared traumatic experiences following the fire. So how can we promote Indigenous health and well-being following a disaster? So one of the things that my team and I worked towards was creating a framework for promoting Indigenous health and well-being. This is a framework that can be applied in future disasters or other public health crises. And it really speaks to highlighting aspects of an Indigenous model of health and wellness. So it includes things like a holistic framework for understanding health and well-being. So under a holistic framework, Indigenous peoples do not separate physical, mental, and spiritual health, nor do they separate human health from that of the rest of the earth. One of the recommendations for incorporating a holistic framework in a disaster and emergency response is around cultural competence. So really enhancing and strengthening cultural competency among health service providers or health professionals, as well as emergency responders. And that would ensure cultural competency ensures the respect of Indigenous views of the world, ways of knowing, and values. It's important that we emphasize community-led emergency plans, and that includes the incorporation of Indigenous knowledge and Indigenous capacity, as well as community ownership and control in setting, in identifying and implementing emergency and disaster response plans within the community, and ensuring strong community engagement that's involved in the development of those plans. Another aspect of an Indigenous-led disaster response plan is that First Nations or all Indigenous peoples, aside, including non-Indigenous residents, should expect to see the same rapid response and return to pre-emergency standards following a disaster. So one of the gaps in the research is that there aren't any indicators of successful emergency management. So it's difficult for us to know where some of those inequities are, including resource inequities, in how we respond or how decision makers respond to a disaster, and that affects both Indigenous and non-Indigenous populations. So one of the recommendations that would fall from that is to ensure that federal and provincial jurisdictional issues need to be clarified in the best interest, in the spirit of reconciliation. Another key component of the framework is who we employ or who is engaged to respond on the ground. So contractors and others are often selected by outside governments or organizations. And so one of the things for us to think about as a recommendation is building that capacity within the communities as well, and encouraging communities to be closely involved in community assessments or hazard assessments. Strong communication. This is something that comes out in almost any research or study of a natural disaster, is how strong the communication system was in communicating the risks of the disaster. So in this context of wildfire, so how those risks are communicated to Indigenous communities, how those risks are framed, how Indigenous communities are also engaged in the framing of the impacts that resulted from the wildfire. So these are all important considerations in our in a disaster and emergency response plan. And lastly, emergency and disaster plans need to be written with respect to Indigenous worldviews, ways of knowing, and values. So moving forward, following our research on the health and mental health impacts for the Fort McMurray wildfire among Indigenous residents and communities, is we're working towards creating an Indigenous mental health strategy for the region of Wood Buffalo. And this is following the Fort McMurray wildfire. So one of the things that we did was we ensured widespread consultation and engagement among mental health professionals, including elders, youth, and those across the sectors, so education, justice, and health, to generate and prioritize key directions for an Indigenous-focused mental health response in the region. And this is really coming out of some of the significant mental health impacts that have resulted from the wildfire. And for those following the news, you would have heard that Fort McMurray has recently experienced a flood in May of this year. So as one elder would say, it's one traumatic event after another, so trauma on top of trauma. And so it's important for us to think to the future. And this is an example of how we're learning about what those mental health impacts particularly were following the 2016 wildfire. And how can we change this in terms of better responding to ensuring that Indigenous residents and communities have access to needed mental health services and supports in the event or in the context of future disasters. So I'll leave it at that. Thank you so much for the opportunity to talk a little bit about the work that we led following the 2016 Horse River wildfire in Wood Buffalo. Please do not hesitate to contact me if you have any questions or follow me on Twitter. Thank you.